Hi, good day. I'm Clerk Lakkian, and today we are going to perform fundoscopy and ophthalmic drug administration in pediatric patient. First, let's talk about fundoscopic examination. Retina is the only portion in the CNS that is visible in the exterior. The fundus is the only location where vasculature can be visualized. And the examination of the ocular fundus is an integral part of the physical examination of a child. By means of fundoscopic examination, we can diagnose the patient if he or she has glaucoma, shaken baby syndrome, or retinal detachment. Inspection of the ocular fundus may also help in the management of several systemic disorders like diabetes mellitus and SLE. Your fundoscopic examination permits the examiner to visualize the internal structure of the eye in a child who is able to sit for examination and focus steadily on a distant point. And in fundoscopic examination, we are going to utilize your direct ophthalmoscope. Now let's proceed to the procedure of fundoscopic examination. Before starting the procedure, we must dim the lights and make sure to wash our hands properly. We might encounter different types of patients, like slightly cooperative children or totally uncooperative children. So, for a lightly cooperative child, you can pretend to play to gain his trust and cooperation. For totally non-cooperative patient, you can ask the parent to hold the child and let him sit on the lap and wait for the child to calm down and relax before you proceed with the examination. You will start by explaining to the parent that you are going to examine the child's eyes. Then ask the child to focus on a distant point. You may use eye-catching object to make the child focus on a distant point. You can also tell the child that the ophthalmoscope is not harmful, so that the child will not be afraid and will be cooperative in the examination. Hold the ophthalmoscope in your right hand and approach the child's right eye from his right side using your right eye. From distance of 20 cm, bring the red reflex into focus. Then come close to the child's head and adjust the lens until the retina comes into focus. Then examine now the lens, disc, cup margins, vessels, and retinal surfaces, and then look for abnormalities. So this will be the normal fundus, wherein the normal blood vessels emerge from the nasal side of the optic disc, and also shows that the arteries are narrower than the veins. So next is the ophthalmic drug administration. Many ocular medications are prescribed and used in pediatric patients. And there are three primary methods of delivery of ocular medications: the topical, the local ocular, and the systemic. How to safely administer ophthalmic drugs? Before putting an eye drop in pediatric patients, never forget to wash or disinfect your hands. Always be careful not to touch the dropper in the eyes or surrounding tissue to avoid hurting the eye and contamination of the drops. And don't worry if the occasional drops are missed. For older children, get your child to sit in a comfortable chair with head tilted backwards and head upwards to the ceiling. Then ask them to open both eyes and look up towards their eyebrows. Gently pull down the lower lid and put the drops into the pocket between the lower lid and the eye. If this is difficult, you can also ask them to close their eyes gently and place the drop on the skin in the corner of the eyelids. Your child can then open their eye and you can gently pull their lids using your index finger and your thumb, and the drops will roll into the eye. This is best done with the child lying flat in bed. Whenever you can, older children needing long-term drops should be encouraged to put the drops in. Babies and young children often don't understand why they need drops and can wriggle and close their eyes. Often, you will need to use some techniques to keep them still. As long as this is done quickly, you will get the drops in safely with as little upset as possible. Ideally, get another adult to help. Get your child lay down or lie back in someone's arm if very young. Sometimes, swaddling them in a blanket can help keep the arm and legs out of the way. Allow your child to close their eyes, and you can then use one of the two techniques. Firstly, you can use your thumb and index finger and put the drop into the eye. If it's difficult, if you can get them lying flat, put a couple of drops into the skin by the inside corner of the eye, then depending on the age, either ask them to blink several times to allow the drops to run in, or gently part the lids to allow the drops to flow in. If you are alone, there are ways to allow you to instill the drops. Sit on the floor with legs straight out in front of you and slightly apart. Lay the patient between your legs so that the head is kept still between your thighs and your arms stuck under your knees. This allows you to get the drops in quickly, and there is no chance of your child to hurt themselves. Next is how to properly apply eye ointment. To administer this medication, you will need the eye ointment and some tissue to wipe excess eye ointment. First thing to do is check the label to make sure you have the right medication. Check also for the expiration date before administering the medication to the patient. If you are going to use eye drops at the same time as the ointment, then you should leave the ointment to last. So take off the cap, and you will see a small nozzle where the ointment will come out. Try to avoid the tip of the tube from touching any part of the child's eye if possible. Then gently pull the lower lid down and squeeze the tube gently so the application of the ointment is squeezed on to the pocket of the eye and the eyelid. The ointment will automatically spread into the eyes as the child blinks. And lastly, do not forget to tell that their vision might be blurry after a couple of seconds after the administration of the medication. And that ends our demonstration. I hope you learned something today. Thank you for watching.